Question 1. You are working with a client who often screams and drops to the floor during transitions. Your supervisor suspects this is maintained by escape from the next activity. The behavior plan instructs you to physically guide the client through the transition when this behavior occurs. This is an example of implementing which procedure? A. Positive reinforcement. B. Negative punishment. C. Escape extinction. D. Timeout. Answer: C. Escape extinction. Explanation: this question describes a situation where a client engages in a behavior, screaming and dropping, to avoid something they dislike, transitions, and the intervention involves preventing them from escaping by ensuring they complete the transition despite the behavior. The keyword escape is the crucial clue, indicating the presumed function. When a behavior is maintained by escape, and you prevent the escape from occurring following the behavior, you are implementing escape extinction. The behavior, screaming/dropping, no longer results in getting out of the transition. Positive reinforcement. A. Increases behavior by adding something. Negative punishment. B. Decreases behavior by removing something. Timeout. D. Involves removing access to reinforcement. By physically guiding them through the transition, you are blocking the escape, which is escape extinction. When they try to escape, but you make them do it anyway, that's escape extinction. Question 2. Your supervisor wants you to collect inter-observer agreement, IOA, on the client's hand flapping, which is measured using partial interval recording with 1-minute intervals. You and another observer simultaneously collect data. For each interval, you check if you both marked yes or no. What is this method of calculating IOA called? A. Total count IOA. B. Interval by interval IOA. C. Total duration IOA. D. Momentary time sampling IOA. Answer: B. Interval by interval IOA. Explanation: this question asks about a specific method for calculating IOA when using interval recording methods like partial interval recording. The phrase, for each interval, you check if you both marked yes or no, is the key. Interval by interval IOA compares the two observers' recordings for each individual interval and calculates the percentage of intervals where both observers agreed. Either both marked yes or both marked no. Total count IOA. A is for frequency, comparing overall counts. Total duration IOA. C is for duration, comparing overall time. Momentary time sampling IOA is calculated similarly to interval by interval, but this question specifically uses a general interval recording scenario. Comparing each interval one by one for agreement is interval by interval IOA. You check if you agreed in each little time box. Question 3. A client typically engages in repetitive vocalizations, behavior. The behavior plan states that if they are quiet for 30 seconds, absence of behavior, you should provide a preferred edible reinforcer. If they vocalize, the timer resets. Over several sessions, you notice the client's vocalizations are gradually decreasing. This is an example of which differential reinforcement procedure? A. DRA. Differential reinforcement of alternative behavior. B. DDRI. Differential reinforcement of incompatible behavior. C. Fixed interval DRO. Differential reinforcement of other behavior. D. Variable interval DRO. Differential reinforcement of other behavior. Answer: C. Fixed interval DRO. Differential reinforcement of other behavior. Explanation: this question describes a specific type of differential reinforcement where you reinforce the absence of a target behavior if they are quiet for 30 seconds. The key phrase for 30 seconds refers to a specific, unchanging time interval, and reinforcement is delivered if the behavior, vocalizing, does not occur during that entire fixed interval. If the behavior occurs, the timer resets, meaning they lose the opportunity for reinforcement in that interval. This is a fixed interval DRO schedule, DRA. A reinforces a specific alternative behavior. DRI. B. Reinforces a behavior that is physically incompatible, variable interval DRO. D. Would use intervals of changing length. You're rewarding them for not doing the behavior for a specific, fixed amount of time. Question 4. You are working with a client in their home. During the session, the client's sibling comes into the room and offers the client a highly preferred toy while the client is engaging in a challenging behavior. The client takes the toy, and the challenging behavior stops. This toy was not part of your planned reinforcement. What concept does this best illustrate? A. Planned reinforcement. B. Incidental teaching. C. Unplanned reinforcement. D. Extinction. Answer: C. Unplanned reinforcement. Explanation: this question describes a situation where a behavior is reinforced, but not as part of the intentional, written behavior plan. The keywords are the sibling providing the toy, it stopping the challenging behavior, implying reinforcement, and it not being part of your plan. This is an example of unplanned reinforcement, where something in the environment or another person's action unintentionally reinforces a behavior, often a challenging one. Planned reinforcement, A, is part of the intervention designed by the supervisor. Incidental teaching, B, is a naturalistic teaching method. Extinction, D, is withholding reinforcement. Unplanned reinforcement can make behavior plans less effective because the behavior is still getting rewarded, just not by the person implementing the plan. Something in the environment accidentally rewarded the behavior. Question 5. When assisting with a functional analysis, your supervisor tells you that in the tangible condition, you should present the client with attention frequently and provide difficult tasks. And if the client engages in the target behavior, you should remove the difficult task and attention and provide a preferred toy for a brief period. What is the likely purpose of this tangible condition within the functional analysis? A. To test if the challenging behavior is maintained by escape from demands. B. To test if the challenging behavior is maintained by attention. C. To test if the challenging behavior is maintained by access to tangibles. D. To test if the challenging behavior is maintained by automatic reinforcement. Answer: C. To test if the challenging behavior is maintained by access to tangibles. Explanation: this question describes a specific condition, sometimes used in a functional analysis to test for the tangible function. In this condition, you are setting up a situation where attention and demands are freely available, making them less likely reinforcers in this context, and access to preferred items, tangibles, is limited if the challenging behavior occurs and is followed by access to a tangible, the toy. And this pattern causes the behavior to occur more in this condition than others. It suggests the behavior is maintained by access to tangibles. Escape, A, is tested by removing demands. Attention, B, is tested by providing attention following the behavior. Automatic, D, is tested in a condition with no social consequences or clear environmental changes. This condition is designed to see if they do the behavior to get the toy. Question 6. You are using a least to most prompting strategy to teach a 5-step task analysis. The client mastered step 1 independently. During the next trial, you say the SD for the chain. The client completes step 1 independently, but then pauses. You wait 3 seconds, but they don't do step 2. According to LTM, what is your next action? A. Immediately provide a full physical prompt for step 2. B. Provide the least intrusive prompt for step 2 that is likely to be effective, based on your hierarchy. C. Guide them through all remaining steps, 3 to 5, with full physical prompts. D. Record an error and end the trial. Answer: B. Provide the least intrusive prompt for step 2 that is likely to be effective, based on your hierarchy. Explanation: this question combines least to most prompting with chaining. In LTM, when the client doesn't respond correctly after the initial opportunity, after completing step 1 and pausing. You provide the next level of prompt in your predetermined hierarchy, starting with the least intrusive prompt likely to result in a correct response for that specific step. Step 2. You don't jump to the most intrusive prompt immediately, unless that's the very next step in your hierarchy for that specific step, or if your hierarchy is only 2 levels, least/most. Guiding through all remaining steps with full prompts, C, would be more like total task chaining or a different prompting approach. Recording an error, D, ends the learning opportunity. LTM involves systematically increasing assistants one step at a time as needed. Since they didn't do the next step, give them just enough help to do that step according to your LTM plan. Question 7. When reviewing a graph, you observe that the data points consistently fall along a line that is moving upwards and to the right. What does this suggest about the behavior? A. The behavior is variable. B. The behavior is decreasing. C. The behavior is stable. D. The behavior is increasing. Answer: D. The behavior is increasing. Explanation: this question asks about interpreting the trend of data on a line graph. Data points that move upwards and to the right indicate an increasing trend in the behavior over time. Variability, A, refers to how spread out the points are, not the overall direction. Decreasing behavior, B, would show a downward trend. Stable behavior, C, would show a flat trend line. An upward slope means the behavior is happening more often or for longer durations over time. If the line is going up, the behavior is happening more. Question 8. Which ethical consideration is most relevant when determining how often to conduct preference assessments for a client? A. Maintaining confidentiality. B. Ensuring client assent. C. Using assessment to guide treatment decisions. D. Avoiding conflicts of interest. Answer: C. Using assessment to guide treatment decisions. Explanation: this question relates ethical practice to assessment frequency. Preference assessments are conducted to identify effective reinforcers, which are essential for effective skill acquisition and behavior reduction interventions. Ethically, services should be guided by data and assessment. Therefore, conducting preference assessments often enough to ensure you are using current, effective reinforcers is directly tied to the ethical responsibility to use assessment to inform and guide treatment decisions that benefit the client. Confidentiality, A. Assent, B. And avoiding conflicts, D, are crucial ethical principles, but the frequency of assessment is most directly linked to ensuring assessment data is current and driving effective treatment. Do preference assessments often enough to make sure the rewards you're using are still motivating for the client. Question 9. A client is being reinforced on a VR10 schedule for saying hello. This means they are reinforced for saying hello after A. Exactly 10 minutes. B. Approximately every 10 minutes. C. Exactly 10 responses. D. Approximately every 10 responses. Answer: D. Approximately every 10 responses. Explanation: this question tests your understanding of a variable ratio. VR, schedule, ratio means reinforcement is based on the number of responses. Variable means the number of responses required for reinforcement changes unpredictably, but averages out to the number given, 10. So the client will be reinforced after 7 responses, then maybe 12, then 9, then 13, etc., averaging approximately 10 responses across many trials. Option A is fixed interval. Option B is variable interval. Option C is fixed ratio. VR10 means the reward comes after an average of 10 responses. They get the reward after an average number of responses, and that number changes unpredictably. Question 10. You are asked to collect data on a client's vocal stereotypy, repetitive sounds. Your supervisor suggests using momentary time sampling because it's a high-rate behavior and difficult to count every instance. You set intervals for 1 minute. When the timer beeps, you look up and the client is vocalizing. How do you record this? A. Mark yes for the interval. B. Mark no for the interval. C. Mark that it occurred for the entire interval. D. Record the frequency during the interval. Answer A. Mark yes for the interval. Explanation. This question tests your application of momentary time sampling measurement. In momentary time sampling, you record whether the target behavior, vocalizing, is occurring at the precise moment the interval ends. When the timer beeps, since you looked up when the timer beeped and the client was vocalizing at that moment, you mark yes for that interval. Marking no, B, would be if they were not vocalizing at that moment. Marking for the entire interval, C, is whole interval recording. Recording frequency, D, isn't part of time sampling procedures. You only check if they were doing it right when the timer went off. Were they doing it exactly when the timer beeped? If yes, mark yes. Question 11. A client often refuses to eat non-preferred foods, behavior which results in the food being removed. Consequence. This behavior is likely maintained by A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer C. Escape. Explanation. This question asks you to identify the likely function of a behavior based on the provided antecedent and consequence. The client engages in a behavior, refusal to eat, that results in the removal of something they dislike, non-preferred food. When a behavior is strengthened because it leads to getting away from or avoiding something aversive, it is maintained by escape. Attention. A. Would be getting social interaction. Access to tangibles. B. Would be getting a preferred item. Automatic reinforcement. D. Would be related to sensory input. If the behavior gets them out of something they don't like, the function is escape. The behavior helps them get away from the food. Question 12. When assisting with a functional analysis, your supervisor tells you that in the attention condition, you should provide the client with easy tasks and access to toys/activities freely. And if a client engages in the target behavior, you should provide brief attention example, oh no, don't do that. What is the likely purpose of this attention condition? A. To test if the challenging behavior is maintained by escape from demands. B. To test if the challenging behavior is maintained by attention. C. To test if the challenging behavior is maintained by access to tangibles. D. To test if the challenging behavior is maintained by automatic reinforcement. Answer. B. To test if the challenging behavior is maintained by attention. Explanation. This question describes a condition sometimes used in a functional analysis to test for the attention function. In this condition, other potential reinforcers, escape from demands, access to tangibles, are minimized by providing easy tasks and free access to items. If the challenging behavior occurs and is followed by attention from the therapist, and this pattern causes the behavior to occur more in this condition, it suggests the behavior is maintained by attention. Escape, A, is tested by presenting demands and allowing escape. Tangible, C, is tested by withholding tangibles and providing them after the behavior. Automatic, D, is tested in a low stimulation environment without social consequences. This condition is designed to see if they do the behavior to get you to interact with them. Question 13. Which type of reinforcement contingency is described when a client engages in a behavior and an aversive stimulus is removed, leading to an inseries in that behavior in the future? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. B. Negative reinforcement. Explanation. This question asks you to identify a specific reinforcement contingency. Reinforcement means the behavior increases. Negative means something is removed or taken away. So, negative reinforcement is when a behavior increases because it leads to the removal of an unpleasant stimulus. Positive reinforcement. A. Increases behavior by adding something. Positive punishment. C. Decreases behavior by adding something unpleasant. Negative punishment. D. Decreases behavior by removing something pleasant. The behavior works because it makes something bad go away. Question 14. You are graphing frequency data on a client's hitting behavior. You notice a clear downward trend across intervention phase data points. However, the supervisor notes that the session length varied significantly, from 15 to 45 minutes. Why might this variability in session length be a problem for interpreting the frequency data? A. Frequency data is only meaningful for short sessions. B. The trend might be misleading because a higher frequency might occur in longer sessions, even if the rate of hitting per minute decreased. C. Variability in session length only impacts duration data, not frequency. D. You should have used interval recording instead of frequency. Answer. B. The trend might be misleading because a higher frequency might occur in longer sessions, even if the rate of hitting per minute decreased. Explanation. This question highlights a potential issue with interpreting frequency data when observation periods, session lengths, vary. Frequency is a raw count. If a session is longer, there's simply more time for the behavior to occur, potentially leading to a higher frequency count. Even if the behavior is happening less often per minute example, the rate has decreased. When session length varies, calculating and graphing the rate of the behavior, frequency per unit of time, like instances per minute or hour, is more informative than just frequency because it standardizes the measurement across different time periods, giving a more accurate picture of change. Frequency alone can be misleading when time varies. When session length isn't the same, frequency counts can be confusing. Calculate the rate, count per minute, instead. Question 15. Which ethical principle requires RBTs to act in the best interest of the client? A. Confidentiality. B. Integrity. C. Beneficence. D. Justice. Answer. C. Beneficence. Explanation. This question asks about the ethical principle focused on doing good for the client. Beneficence means promoting the welfare of others and acting in their best interest. Non-maleficence, avoiding harm, is often paired with it. As an RBT, your actions and decisions should always be aimed at benefiting the client and helping them achieve their goals in a safe and effective manner. Confidentiality, A, is about privacy. Integrity, B, is about honesty. Justice, D, is about fairness. Your job is to do what is good for the client. Question 16. You are teaching a client a new skill using discrete trial training. DTT. You present the SD, wait for a response, and if correct, provide reinforcement. What should you do if the client does not respond correctly after the SD and any planned prompt? A. Provide punishment. B. End the trial and record the response as incorrect. C. Repeat the SD and prompt sequence immediately. D. Move to the next trial. Answer. B. End the trial and record the response as incorrect. Explanation. This question is about the standard procedure within a DTT trial after an incorrect or no response. Following the SD and any planned prompts, if the client does not respond correctly, the trial is typically ended. No reinforcement is provided, and you record the response as incorrect. Punishment, A, is generally avoided or used sparingly and only as part of a specific plan. Repeating the sequence immediately, C, or moving to the next trial, D, without recording the data or potentially providing a different consequence, like an error correction procedure if in the plan doesn't follow typical DTT procedure. After an incorrect response, finish that trial, record the data, and move on according to the plan. If they don't get it right after the help, mark it wrong and go to the next trial. Question 17. Which measurement procedure provides an estimate of the minimum percentage of time a behavior occurred and is best suited for behaviors you want to increase? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency. Answer B. Whole interval recording. Explanation. This question asks about a specific interval recording method and its tendency to underestimate behavior, making it suitable for behaviors you want to increase. Whole interval recording requires the behavior to occur throughout the entire interval to be marked. This means if a behavior stops even briefly during the interval, it's not counted, leading to an underestimation of its true occurrence. Because it underestimates, it's a conservative measure often used for behaviors you want to see more of, like staying on task, as an increase in recorded percentage clearly shows the behavior is becoming more continuous. Partial interval, A. Overestimates. Momentary time sampling, C. Can over or underestimate. Frequency, D. Is a count. Whole interval recording makes you work harder to count the behavior, so it underestimates, which is useful for tracking growth in behaviors you want to see more often. Question 18. What is the difference between an EO, establishing operation, and an AO, abolishing operation? A. EO signals reinforcement availability. AO signals no reinforcement. B. EO increases reinforcer effectiveness. AO decreases reinforcer effectiveness. C. EO increases behavior frequency. AO decreases behavior frequency. D. EO is a type of prompt. AO is a type of consequence. Answer B. EO increases reinforcer effectiveness. AO decreases reinforcer effectiveness. Explanation. This question tests your understanding of the two main types of motivating operations, MOs. An establishing operation, EO, is an MO that increases the effectiveness of a stimulus as a reinforcer. Example being hungry makes food more reinforcing. An abolishing operation, AO, is an MO that decreases the effectiveness of a stimulus as a reinforcer. Example being full makes food less reinforcing. They both influence behavior indirectly by changing how much you want something. Option A describes the difference between SD and S delta. Option C describes the effect of reinforcement as punishment or extinction, not NOs directly. Option D is incorrect. Memos are antecedent variables, not prompts or consequences. EOs make you want the reward more. AOs make you want the reward less. Question 19. When using differential reinforcement, you are simultaneously applying which two principles of behavior? A. Reinforcement and punishment. B. Reinforcement and extinction. C. Punishment and extinction. D. Positive and negative reinforcement. Answer B. Reinforcement and extinction. Explanation. This question requires understanding the core mechanism of differential reinforcement procedures, like DRO, DRA, DRI. Differential reinforcement works by reinforcing one behavior, or the absence of a behavior, while simultaneously withholding reinforcement, extinction, for another behavior, by reinforcing the desired behavior and putting the challenging behavior on extinction. You teach the client to engage in the reinforced behavior because it pays off, and the other behavior does not. While punishment might be used in a plan, differential reinforcement itself is based on combining reinforcement and extinction. You reinforce the desired behavior, and you don't reinforce the undesired one. Question 20. You are collecting data on spitting. Your supervisor asks you to ensure your data is objective. Which example is an objective description of spitting? A. Client spit because they were frustrated. B. Client spit to get my attention. C. Client forcefully expelled saliva from their mouth towards the floor. D. Client had inappropriate spitting behavior. Answer C. Client forcefully expelled saliva from their mouth towards the floor. Explanation. This question tests your ability to identify an objective description of behavior. Objective descriptions are based only on what is observable and measurable, without including interpretations of feelings. A. Presumed function. B. or subjective judgments, inappropriate in D. Option C describes the physical action of spitting using observable terms, expelled saliva from mouth towards floor, and a descriptor of the action, forcefully, that could potentially be agreed upon by observers. It's a description of the action, not the feeling or reason behind it. Objective means just the facts of what you see and hear, not what you think or feel about it. Question 21. Which method of calculating IOA is considered the most stringent for frequency data because it requires observers to agree on the occurrence and timing of each instance of the behavior? A. Total count IOA. B. Mean count per interval IOA. C. Exact match IOA. D. Trial by trial IOA. Answer C. Exact match IOA. Explanation. This question asks about the most demanding frequency IOA method. Exact match IOA requires that two observers not only record the same total count of a behavior, but also agree on the exact moment or trial each instance occurred. If observer 1 recorded a hit at 1:05 p.m. and 1:10 p.m., and observer 2 recorded hits at 1:05 p.m. and 1:12 p.m., they would only have 50% exact match agreement even if their total counts were the same. Total count IOA. A. Only compares the final numbers. Mean count per interval. B. Looks at agreement within intervals but not exact timing. Trial by trial. D. Is similar to exact match but used for discrete trials. Exact match means you have to agree on exactly when each behavior happened. Question 22. What type of measurement is generally preferred for behaviors that occur at a moderate, consistent rate and have a clear beginning and end? A. Partial interval recording. B. Whole interval recording. C. Frequency or duration. D. Momentary time sampling. Answer C. Frequency or duration. Explanation. This question asks about the most direct and generally preferred continuous measurement methods for behaviors with clear boundaries. When behaviors have a clear start and stop and aren't happening too fast or too slow, frequency, counting instances, or duration, timing how long each instance lasts, or total time, provide the most precise and informative data. Interval recording methods, B, D, are sampling methods that provide estimates and can over or underestimate the true values compared to continuous measurement. If you can clearly count it or time how long it lasts, use frequency or duration for the most accurate picture. Question 23. A client learns to wash their hands following a task analysis in the therapy room with their RBT. Later, the client washes their hands in the school bathroom with their teacher and also uses slightly different steps they learned from a poster in the bathroom. What two concepts are demonstrated here? A. Stimulus generalization and response generalization. B. Discrimination and maintenance. C. Shaping and chaining. D. Prompt fading and extinction. Answer A. Stimulus generalization and response generalization. Explanation. This question combines two types of generalization. The client performing the skill in a new environment with a new person, school bathroom with teacher, demonstrates stimulus generalization. The behavior occurs in different stimulus conditions. The client using slightly different steps, from the poster, to achieve the same outcome, clean hands, demonstrates response generalization. Different behaviors that serve the same function. Discrimination, B, is responding differently to different stimuli. Maintenance, B, is performing the skill over time. Shaping, C, is modifying a single behavior. And chaining, C, teaches the sequence of steps. Prompt fading, D, and extinction. D are intervention procedures. They did the skill in a new place, stimulus gen, and in a slightly new way, response gen. Question 24. Your supervisor wants you to thin the reinforcement schedule for a client's greeting behavior, which is currently on CRF. Which schedule represents a thinning from CRF? A. VR1. B. FR1. C. Phi 1. D. VR 3. Answer: D. VR 3. Explanation: this question tests your understanding of reinforcement schedules and thinning. Thinning a schedule means moving from reinforcing every instance of the behavior, continuous reinforcement, CRF, to reinforcing only some instances, intermittent reinforcement. CRF is essentially an FR1 schedule, reinforce after one response. To thin, you increase the response requirement or the time requirement. FR1, B, is the same as CRF. VR1, A, is also essentially CRF. Reinforce after an average of one response, meaning nearly every one. Phi 1, C, is interval-based, reinforcing after time, not every response. VR3, D, requires an average of 3 responses per reinforcement, meaning most responses will not be reinforced, which is a thinner schedule than CRF. Thinning means reinforcing less often for the same behavior. Reinforcing only on average every 3 responses is thinner than reinforcing every single response. Question 25. What is the ethical term for using procedures that have been validated by research and are appropriate for the specific client's needs? A. Integrity. B. Confidentiality. C. Evidence-based practice. D. Professionalism. Answer: C. Evidence-based practice. Explanation: this question asks about the ethical principle of using interventions that are supported by scientific research. Evidence-based practice means using interventions and procedures that have been shown to be effective through rigorous research, integrating that evidence with clinical expertise and client values. It's an ethical responsibility to use treatments that are likely to work. Integrity, A. Confidentiality, B. And professionalism, D, are important, but evidence-based practice specifically refers to the scientific backing of your methods. Use treatments that research shows are effective. Question 26. When assisting with a functional analysis, your supervisor tells you that in the alone condition, you should provide minimal stimulation and no social interaction. And if a client engages in the target behavior, you should provide no consequence. What is the likely purpose of this alone condition? A. To test if the challenging behavior is maintained by escape from demands. B. To test if the challenging behavior is maintained by attention. C. To test if the challenging behavior is maintained by access to tangibles. D. To test if the challenging behavior is maintained by automatic reinforcement. Answer: D. To test if the challenging behavior is maintained by automatic reinforcement. Explanation: this question describes a condition sometimes used in a functional analysis to test for the automatic reinforcement function. In the alone condition, social consequences, attention, tangible access, escape from social interaction, and environmental changes, escape from demands, are minimized or absent. If the challenging behavior occurs frequently in this condition, where no external reinforcement is provided, it suggests the behavior is automatically reinforcing. Example: it feels good, provides sensory input, or alleviates an internal state. Because it happens even when nothing external is gained. Escape: A. Attention, B. And tangible, C. Conditions test for those specific social functions. If the behavior happens when they are alone and getting nothing else, it's likely automatic. Question 27. Which type of chaining procedure teaches the links in a task analysis in their natural order, but the client is prompted through all steps in each trial until they can perform the whole chain independently? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Behavior chain interruption strategy. Answer: C. Total task chaining. Explanation: this question describes total task chaining. In this method, the RBT prompts the client through every step of the task analysis sequence in every learning opportunity, providing just enough help for each step as needed. Reinforcement is delivered upon completion of the entire chain. Forward chaining, A, teaches steps from first to last, reinforcing mastery of the initial steps. Backward chaining, B, teaches steps from last to first, reinforcing mastery of the final steps. Behavior chain interruption strategy, D, is a specific procedure used with chaining, not a type of chaining itself. Total task means you practice the whole sequence every time, prompting as needed. Question 28. When visually analyzing data on a graph, which property helps you understand how consistent or predictable the behavior is? A, level, B, trend, C, variability, D, phase. Answer C, variability. Explanation. This question asks about one of the three key properties of visual analysis. Variability refers to how much the data points jump around or differ from each other within a phase. High variability means the behavior is inconsistent or unpredictable, while low variability means it's stable. Level, A, is the average value. Trend, B, is the overall direction. Phase, D, is a section of the graph, not a property describing the data within it. If the points are bouncing around a lot, the behavior is highly variable. Question 29. You are tracking the number of times a client calls out in class. You record a frequency count. What is the corresponding dimension of behavior you are measuring? A, rate, B, count, C, duration, D, frequency as a dimension. Answer D, frequency as a dimension. Explanation. This question asks about the fundamental dimension of behavior represented by a simple count. Frequency, as a dimension, is simply the number of times a behavior occurs. Rate, A, is frequency per unit of time. Count, B, is the result of measuring frequency, but frequency itself is the dimension describing how often something happens. Duration, C, is how long it lasts. Frequency as a dimension is how many times the behavior happens. The dimension is frequency, and the measurement is the count. Question 30. What ethical guideline is most relevant when determining if a client's challenging behavior warrants a restrictive intervention? A, client confidentiality. B, the client's right to effective treatment. C, professional competence. D, avoiding dual relationships. Answer B, the client's right to effective treatment. Explanation. This question focuses on balancing intervention intensity with effectiveness and client rights, while less restrictive options should always be considered first. Least restrictive effective intervention. If those have been attempted and are ineffective, the client has a right to effective treatment, which may, in some cases, necessitate more intensive or restrictive procedures to achieve meaningful behavior change and improve their quality of life. Confidentiality, A, competence, C, and dual relationships, D, are vital but are not the primary drivers when specifically deciding if a behavior plan is necessary and what level of intensity is warranted based on effectiveness and the severity of the behavior. You have to balance using the least restrictive methods with making sure the treatment actually works for the client. Question 31. When using a time delay prompting procedure, you present the SD and then wait a specific amount of time before providing the prompt. What happens to the length of the time delay as the client learns the skill? A, it stays the same. B, it is gradually increased. C, it is gradually decreased. D, it varies randomly. Answer B, it is gradually increased. Explanation. This question asks about fading prompts using the time delay procedure. In time delay, you start with a 0-second delay, presenting the SD and prompt simultaneously. As the client starts responding more quickly, you gradually increase the amount of time you wait after the SD before providing the prompt, example from 0 to 2 seconds, then 4, then 6. The goal is for the client to anticipate the prompt and respond independently to the SD before the prompt is even delivered. Decreasing, C, or randomizing. D, the delay wouldn't facilitate independent responding. Increase the wait time so they learn to respond to the instruction before you give the help. Question 32. Which schedule of reinforcement produces a high, steady rate of responding? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. Explanation: this question asks about the characteristic response pattern of different intermittent reinforcement schedules. Variable ratio, VR, schedules where reinforcement is delivered after an unpredictable number of responses, typically produce high and steady rates of responding because the client doesn't know exactly when the next reinforcement is coming, and every response has the potential to be reinforced. Fixed ratio, A, produces a high rate, but with pauses after reinforcement. Fixed interval, C, produces a scallop pattern with low rates after reinforcement and higher rates towards the end of the interval. Variable interval, D, produces a steady, but typically moderate rate of responding. VR is like a slot machine. You keep pulling because you never know when the next win is coming, leading to lots of tries. Question 33. A client grabs items off shelves at the store. Behavior. Because they like playing with them. Consequence. Your supervisor implements a plan where you give the client a favorite sensory toy to hold before entering the store. Antecedent intervention. What is the likely purpose of this intervention? A. To provide a punisher for grabbing. B. To implement extinction for grabbing. C. To provide a competing stimulus/reinforcer to make grabbing less likely. D. To teach an alternative behavior for grabbing. Answer: C. To provide a competing stimulus/reinforcer to make grabbing less likely. Explanation: this question describes an antecedent intervention aimed at preventing challenging behavior by changing the environment before the behavior happens. Giving the client a preferred sensory toy before they enter the store serves as a competing stimulus or competing reinforcer. It provides an alternative activity that is enjoyable and keeps their hands busy, making them less likely to engage in grabbing behavior. It's not a punisher, A, as it happens before the behavior. It's not extinction, B, as it doesn't involve the consequence for grabbing itself. While it indirectly supports not grabbing, it's primarily about preventing the behavior by providing something else engaging beforehand. It could be part of a comprehensive plan, but the toy itself is the competing stimulus. Give them something good to do before they have a chance to do the problem behavior. Question 34. When calculating IOA for interval recording, like partial or whole interval, you calculate the percentage of intervals where both observers recorded the same occurrence or non-occurrence of the behavior. What is this method called? A. Total count IOA. B. Total duration IOA. C. Interval by interval IOA. D. Trial by trial IOA. Answer: C. Interval by interval IOA. Explanation: this question asks about the standard method for calculating agreement on interval-based data. Interval by interval IOA compares the scoring of each individual interval between two observers. For each interval, you check if they both marked yes or both marked no. The percentage is calculated based on the number of agreements divided by the total number of intervals, multiplied by 100. Total count, A, and total duration, B, are for continuous measures. Trial by trial, D, is used for discrete trial data. You check if you agreed on the score for every single time interval. Question 35. What is the most ethical way for an RBT to address a situation where a client's cultural practices might conflict with a recommended ABA procedure? A. Ignore the cultural practice and implement the ABA procedure as planned. B. Refuse to implement any procedure that conflicts with the cultural practice. C. Discuss the potential conflict with the supervisor and the client's family to find a culturally sensitive and effective solution. D. Implement the procedure but document the cultural conflict in the notes. Answer: C. Discuss the potential conflict with the supervisor and the client's family to find a culturally sensitive and effective solution. Explanation. This question addresses the ethical importance of cultural responsiveness. ABA services should be delivered in a culturally sensitive manner that respects the client's background and values. If a procedure conflicts with cultural practices, the ethical step is not to ignore the culture. A. Refuse services outright. B. Or simply document the conflict without resolving it. D. You must bring this to your supervisor's attention and collaborate with the family to find a way to adapt the plan, if possible, or find alternative procedures that align with both ethical ABA practice and cultural values. Collaboration and finding a middle ground are key. Talk to your supervisor and the family to find a way to provide effective therapy that respects their culture. Question 36. You are working with a client who exhibits property destruction, behavior, when a preferred toy is removed. Antecedent. The behavior plan involves reinforcing the client for playing appropriately with other toys. Alternative behavior. When the preferred toy is removed. What type of differential reinforcement is this? A. DRO. Other behavior. B. DDRA. Differential reinforcement of alternative behavior. C. DDRI. Differential reinforcement of incompatible behavior. D. DDRL. Differential reinforcement of low rates. Answer. B. DRA. Differential reinforcement of alternative behavior. Explanation. This question describes reinforcing a specific behavior, playing appropriately with other toys. That is an alternative to the challenging behavior, property destruction. Both behaviors occur in the same situation, preferred toy removity, and the desired behavior, playing nicely, is reinforced, while the challenging behavior, destruction, is not. This is differential reinforcement of alternative behavior. DRA. A. Would reinforce any behavior other than destruction during a specific time. DRI. C. Would reinforce a behavior physically incompatible with destruction, like sitting on hands. DRL. D. Reinforces a low rate of destruction. You are reinforcing a different, better way to behave when the toy is removed. Question 37. Which professional is responsible for training the RBT on how to implement specific behavior plans and collect data accurately? A. The client's parent or guardian. B. A senior RBT. C. The supervising BCBA or BCABA. D. A school teacher. Answer. C. The supervising BCBA or BCABA. Explanation. This question clarifies the supervisor's role in RBT training and competence. The certified supervisor, BCBA or BCABA, is ethically and professionally responsible for providing training and ensuring the RBT is competent to implement the specific procedures and data collection methods outlined in the client's plan. Parents. A. Senior RBTs. B. Or teachers. D. May provide support or context, but they are not authorized to provide the formal training and competency assessment required for an RBT. Your supervisor is the one who trains you on the client's specific plan. Question 38. You are teaching a client to request preferred items by saying their names. You hold up a cookie and ask, "What do you want?" The client says, "Ku," which is an approximation. You reinforce this approximation. This is an example of which procedure? A. Chaining. B. Discrimination training. C. Shaping. D. Prompting. Answer. C. Shaping. Explanation. This question describes reinforcing a behavior that is not exactly the target behavior, but is a closer step towards it. Saying "ku" instead of "cookie." Shaping is the process of gradually teaching a new behavior by reinforcing behaviors that are successively closer and closer approximations to the final desired behavior. Chaining. A. Teaches a sequence of steps. Discrimination training. B. Teaches different responses to different stimuli. Prompting. D. Is providing help to make the behavior occur. You are reinforcing a closer try at saying the word. Question 39. What is the potential problem with using subjective language in session notes, such as "client was angry today"? A. It makes the notes too long. B. It is not based on observable and measurable behavior. C. It requires too much training to understand. D. It makes it difficult to build rapport with the client. Answer: B. It is not based on observable and measurable behavior. Explanation: this question emphasizes the importance of objective documentation. Subjective language describes internal states, feelings, or interpretations that cannot be directly observed or agreed upon by others. In ABA, behavior and documentation should be objective, describing only what was seen or heard. Example: client furrowed their brow and yelled loudly instead of client was angry. This ensures accuracy and consistency across observers. Length: A is a separate issue. Objectivity is easier to understand than subjective interpretation for others. C. It doesn't directly impact report. D. Objective notes are based on facts, not feelings or guesses. Question 40. When graphing duration data, a break in the data path, a gap in the line, usually indicates: A. A change in the intervention was made. B. No data was collected during that time period. C. The behavior did not occur during that time period. D. The client reached mastery of the skill. Answer: B. No data was collected during that time period. Explanation: this question asks about interpreting graphs, specifically what a break in the line means. A break in the data path on a line graph indicates that data was not collected for one or more planned observation points. Example: a missed session, a period of illness, or a technical issue. A phase change line, A, indicates an intervention change. Data points at 0 would indicate the behavior didn't occur. C. Mastery, D, is usually indicated by meeting a specific criterion on the graph, not a break in the line. A gap in the line means there's missing information. If the line stops, it usually means nobody collected data for a bit. Question 41. What is the term for a consequence that, when removed immediately following a behavior, decreases the future likelihood of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. Explanation: this question describes a consequence where something is taken away or removed, when removed immediately following a behavior, and as a result, the behavior happens less often in the future, decreases the future likelihood. When you take something away to decrease a behavior, it's called negative punishment. Positive reinforcement: A. Add something to increase behavior. Negative reinforcement: B. Take something away to increase behavior. Positive punishment: C. Add something to decrease behavior. If taking away something good, negative, makes the behavior go down, punishment, it's negative punishment. Question 42. Which type of behavioral momentum involves increasing the likelihood of a low probability request by presenting it immediately after several high probability requests have been reinforced? A. High probability request sequence, high P. B. Low probability request sequence, low P. C. Behavioral contrast. D. Stimulus fading. Answer: A. High probability request sequence, high P. Explanation: this question describes the high probability request sequence, often called high P or behavior momentum. This is an antecedent intervention where you present several requests that the client is very likely to follow and reinforce them quickly. Then, immediately following this sequence of compliance, you present a request that the client is less likely to follow, the low P request. The momentum of complying with the high P requests makes it more likely they will comply with the low P request. Low probability request sequence, B, isn't a standard term for this. Behavioral contrast, C, is changes in behavior in one setting due to changes in another. Stimulus fading, D is gradually changing a stimulus. Build up momentum by asking them to do easy things first, then ask them to do the harder thing. Question 43. When thinning a reinforcement schedule from CRF, which type of intermittent schedule is typically introduced first? A. Variable interval, VI. B. Variable ratio, VR. C. Fixed ratio, FR. D. Fixed interval, FI. Answer: C. Fixed ratio, FR. Explanation: this question asks about the common initial step when thinning from continuous reinforcement, CRF, which is FR1. A common progression when thinning is to move from CRF to a low fixed ratio schedule, like FR2 or FR3. This maintains a relatively high rate of reinforcement while introducing the concept that not every response is reinforced. Moving directly to interval schedules, a D, or higher ratio schedules like VR. B might be too large a step for the client immediately after CRF, potentially leading to a decrease in the desired behavior. Start by reinforcing after a small, fixed number of responses, more than one. After reinforcing every time, start reinforcing after just a few responses, like every second or 3 RBT. Question 44. You are tracking whether a client is sitting in their seat. You divide the session into 1-minute intervals. If the client is sitting for the entire 1-minute interval, you mark yes. If they leave their seat at all during the interval, you mark no. Which measurement procedure is this? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency. Answer: B. Whole interval recording. Explanation: this question describes a specific interval recording method. Whole interval recording requires the target behavior, sitting in seat, to occur continuously for the entire duration of the interval to be recorded as a yes. If the behavior stops at any point within the interval, you mark no. Partial interval. A. Would mark yes if it occurred at any point. Momentary time sampling. C. Checks only at the end. Frequency. D. Is counting instances of leaving the seat, not sitting in it. The behavior has to fill the whole time box to be counted. Question 45. A client learns to say juice when they want juice. Later, they see a picture of juice and say juice. This is likely an example of A. Manding generalizing to tacting. B. Tacting generalizing to manding. C. Stimulus generalization. D. Response generalization. Answer: A. Manding generalizing to tacting. Explanation: this question describes a behavior, saying juice, that was initially learned as a request controlled by the desire for juice, a mand. Later, the same verbal response occurs in the presence of a nonverbal stimulus, seeing the picture of juice, controlled by that stimulus, which is characteristic of a tact. Labeling. This is an example of the verbal response learned as a mand coming under the control of a different type of stimulus, a nonverbal one, essentially generalizing from one verbal operant contingency to another. It's the same word, but now triggered by seeing the picture, not just wanting the juice. The word learned as a request is now being used as a label because they see the picture. Question 46. Which ethical guideline emphasizes using the most effective procedures available based on scientific evidence? A. Justice. B. Beneficence and right to effective treatment. C. Integrity. D. Professionalism. Answer: B. Beneficence and right to effective treatment. Explanation: this question is closely related to evidence-based practice, Q25, but focuses on the ethical principle driving it. The principle of beneficence, doing good, implies providing the most effective treatment possible. The field also specifically identifies the right to effective treatment as a key ethical principle, meaning clients have a right to receive interventions that have been shown to work. Integrity, C, is honesty, justice. A is fairness. Professionalism, D, is a broad term. Doing good for the client involves using treatments that work best. Question 47. Your supervisor asks you to use differential reinforcement to decrease a challenging behavior. This means you will reinforce A. The challenging behavior on a thin schedule. B. Any behavior other than the challenging behavior while withholding reinforcement for the challenging behavior. C. Only responses that are physically incompatible with the challenging behavior. D. The challenging behavior at a lower rate. Answer B. Any behavior other than the challenging behavior while withholding reinforcement for the challenging behavior. Explanation. This question provides the broad definition of differential reinforcement of other behavior, DRO, as a common application of differential reinforcement, covering the core principle of reinforcing something else or nothing when the behavior doesn't occur, while DRA and DRI reinforce specific alternative/incompatible behaviors, which is a type of differential reinforcement. DRO reinforces any behavior other than the target. The unifying principle is reinforcing a desired behavior or absence of behavior, while putting the challenging behavior on extinction. Option A would increase the challenging behavior. Option C describes DRI specifically, not all differential reinforcement. Option D describes DRL. Differential reinforcement means you reinforce something good and don't reinforce the problem behavior. Question 48. When should an RBT decline to implement a behavior plan or procedure? A. If they think the plan won't work for the client. B. If the plan is outside their scope of competence or they have not been trained/supervised to implement it. C. If the client's behavior gets worse after implementing the plan. D. If the plan is different from what the parents expected. Answer B. If the plan is outside their scope of competence or they have not been trained/supervised to implement it. Explanation. This question addresses the ethical boundary of competence. An RBT must only implement procedures they have been trained and supervised to perform. If a supervisor asks an RBT to implement a procedure they are not competent in, the RBT has an ethical obligation to inform the supervisor and decline until appropriate training and supervision are provided. Thinking the plan won't work, A, or the behavior worsens, C, should be discussed with the supervisor, not lead to independent refusal to implement. Parent expectations, D, are important but don't override the supervisor's plan or the RBT's ethical obligations regarding competence. Don't do anything you haven't been trained and supervised to do. Question 49. What is the primary reason for fading prompts? A, to increase prompt dependency. B, to decrease the client's reliance on prompts and promote independence. C, to make the therapist's job easier. D, to determine the function of the behavior. Answer B, to decrease the client's reliance on prompts and promote independence. Explanation. This question asks about the main goal of prompt fading. Prompts are temporary supports. The purpose of gradually reducing prompts is to transfer stimulus control from the prompt to the natural testee, so the client performs the behavior independently when the natural cue is present, without needing help. Option A is the opposite of the goal. Option C might be a side effect but isn't the purpose. Option D is done through functional assessment. The whole point is to help them do it on their own without your help. Question 50. You are using a task analysis to teach a client to make a sandwich. You provide prompting as needed for each step and reinforce after the client successfully completes the very last step, putting the sandwich on a plate. What type of chaining is this? A, forward chaining. B, backward chaining. C, total task chaining. D, behavior chain interruption strategy. Answer B, backward chaining. Explanation. This question describes backward chaining. In backward chaining, you teach the steps starting from the end of the chain. The RBT prompts the client through all steps except the last one initially. Once the client independently completes the last step, reinforcement is delivered. Then you teach the second to last step, prompting earlier steps, and reinforce after the client independently completes the second to last step and the final mastered step. Reinforcement is delivered after the completion of the chain, which in backward chaining starts with the last step independently mastered. Forward chaining A. Reinforces initial steps. Total task chaining C. Reinforces after completing the whole chain, prompting as needed throughout. You reinforce finishing the job, and you taught them the last step first. Question 51. When is it ethically acceptable for an RBT to receive clinical supervision from someone who is not a BCBA or BCABA? A. If that person is a licensed psychologist. B. If that person is a medical doctor. C. If that person is a certified special education teacher. D. Never. RBT supervision must be provided by a BCBA or BCABA. Answer D. Never. RBT supervision must be provided by a BCBA or BCABA. Explanation. This question addresses the strict requirement for RBT supervision. According to the Behavior Analyst Certification Board, BATB, ethical guidelines, RBT services must be supervised by a qualified BCBA or BCABA. No other professional certification or license fulfills this requirement. Supervision from a psychologist, A. Medical doctor, B. Or teacher, C. Does not count as RBT supervision according to the BACB standards. Your required supervision must come specifically from a BCBA or BCABA. Question 52. You are tracking the number of times a client requests a break. This is a discrete behavior with a clear start and stop. Which continuous measurement procedure is most appropriate? A. Duration. B. Latency. C. Frequency. D. Partial interval recording. Answer C. Frequency. Explanation. This question asks for the most appropriate continuous measurement for a behavior that occurs as distinct, countable events. Requesting a break is a behavior you can easily count each time it happens. Frequency measurement is simply counting the number of times the behavior occurs. Duration, A. Would measure how long each request lasts, if applicable, or how long they are on break. Latency, B. Would measure the time from needing a break to requesting one. Partial interval recording, D. Is discontinuous and only gives an estimate. Counting every time the behavior happens is frequency. Question 53. What is a key ethical consideration when using conditioned reinforcers, like tokens or praise? A. They must be paired with primary reinforcers. B. Their value must be regularly assessed through preference assessments. C. They must be delivered immediately after the behavior. D. They must be tangible items. Answer B. Their value must be regularly assessed through preference assessments. Explanation. This question highlights an ethical and practical consideration for using conditioned reinforcers. Unlike primary reinforcers, whose value is inherent, the value of conditioned reinforcers is learned and can change. Ethically and for effectiveness, it's important to ensure the stimuli you are using as reinforcers are still motivating for the client. This requires regularly assessing their preferences for conditioned reinforcers and the backup reinforcers they can exchange tokens for. While pairing, A. Immediacy, C. And tangibility. It's not always true are important aspects of using reinforcers. Regularly checking their effectiveness is crucial for ethical and effective practice. Make sure the rewards you're using still work by checking preferences often. Question 54. Which of the following is an example of response generalization? A. A client learns to say car when shown a picture of a car and later says car when they see a toy car. B. A client learns to ask for a cookie by saying cookie and later also asks by saying want cookie. C. A client learns to follow instructions from their RBT and later follows instructions from their teacher. D. A client learns to wash their hands in the clinic and later washes their hands at home. Answer B. A client learns to ask for a cookie by saying cookie and later also asks by saying want cookie. Explanation. This question asks you to identify response generalization. Response generalization occurs when a client learns a specific behavior in response to a stimulus, and then also performs different but related behaviors that serve the same function in the presence of that or similar stimuli. In this example, saying cookie and saying want cookie are two different verbal responses that both function as requests for a cookie. Option A, C, and D are examples of stimulus generalization. The same behavior occurs in different situations or with different stimuli. Response generalization is using different ways to get the same result. Different behaviors get the same outcome. Question 55. When visually analyzing data, what does a change in level on a graph represent? A. The rate of change in the behavior, steepness. B. The average value of the behavior changes between phases. C. How much the data points bounce around. D. The time period during which data was collected. Answer B. The average value of the behavior changes between phases. Explanation. This question asks about interpreting level changes on a graph. A change in level occurs when the data points in one phase are generally higher or lower than the data points in the previous phase. It represents a shift in the average or typical value of the behavior. Trend. A is the slope, variability. C is how scattered the points are, the time period. D is shown on the x-axis. A level change means the behavior is happening at a new average rate or duration. The typical amount of behavior changed. Question 56. What is the ethical guideline that prohibits RBTs from misrepresenting their certification or qualifications? A. Integrity. B. Confidentiality. C. Professional boundaries. D. Responsibility. Answer A. Integrity. Explanation. This question relates to honesty in your professional presentation. Integrity includes being truthful and accurate in all professional activities, including describing your qualifications, training, and certification status. Misrepresenting yourself is dishonest and violates the principle of integrity. Confidentiality. B. Professional boundaries. C. And responsibility. D are important, but integrity specifically covers truthfulness about your professional status. Be honest about your training and certification. Question 57. A client often engages in screaming behavior when they are asked to clean up toys, antecedent, and this results in the task being removed. Consequence. Which function is most likely maintaining this behavior? A. Attention. B. Tangible. C. Escape. D. Automatic. Answer C. Escape. Explanation. This question asks you to identify the likely function based on the ABCs. The behavior, screaming, occurs in the presence of a demand, clean up toys, and results in the removal of that demand, task removity. This pattern is characteristic of the escape function. The client is screaming to get out of doing something they don't want to do. Attention, A, would be getting social interaction. Tangible. B, would be getting a preferred item. Automatic. D, would be sensory input. If the behavior helps them avoid or get out of a demand, the function is escape. The behavior is happening because it gets them out of the cleanup task. Question 58. When conducting a preference assessment, a client repeatedly chooses a specific toy car over all other items presented. This suggests the toy car is A. A conditioned punisher. B. A highly preferred item that could function as a reinforcer. C. A stimulus delta, SD. D. An aversive stimulus. Answer B. A highly preferred item that could function as a reinforcer. Explanation. This question asks about the interpretation of preference assessment results. If a client consistently chooses an item over others, it indicates a strong preference for that item. Items that are highly preferred are likely to function as reinforcers when made contingent on behavior, although their actual reinforcing effect must be verified by seeing if they increase the target behavior. It's not a punisher, a D, as they are choosing it. It's not an S delta, C, as it's something they are approaching or choosing. A strong preference means the item is likely to be a good reward. What they choose most often in a preference assessment is likely a good potential reward. Question 59. What is the potential ethical issue if an RBT shares details about a client's challenging behavior in a public place, even without using the client's name? A. It violates the principle of integrity. B. It is outside the RBT's scope of practice. C. It could still be a breach of confidentiality if the client could be identified. D. It demonstrates a lack of professionalism. Answer: C. It could still be a breach of confidentiality if the client could be identified. Explanation: this question addresses a nuanced aspect of confidentiality. Confidentiality requires protecting client information, and while names are sensitive, sharing details about unique behaviors, circumstances, or locations in public can still lead to the client being identified by someone who knows them. Therefore, discussing client information in public places, even without a name, is a risk to confidentiality. Integrity: A. Is about honesty. Scope of practice: B. Is about performing your job duties. Lack of professionalism: D. Is true, but breach of confidentiality is the core ethical violation here. You might still be able to figure out who the client is from the details you share, which violates privacy. Be careful what you say and where you say it. Even without names, details can reveal identity. Question 60. When teaching a client to brush their teeth using forward chaining, you reinforce after they independently complete the step, put toothpaste on brush. This is the first step you are targeting for independent completion. What should you do on subsequent trials once this step is mastered? A. Continue reinforcing only after put toothpaste on brush is completed. B. Provide reinforcement only after the entire task is completed independently. C. Provide reinforcement after they independently complete put toothpaste on brush, and the next step, put brush in mouth. D. Switch to backward chaining for the remaining steps. Answer: C. Provide reinforcement after they independently complete put toothpaste on brush, and the next step, put brush in mouth. Explanation: this question requires applying the reinforcement rule for forward chaining after a step is mastered. In forward chaining, once a step is mastered, you continue to require the client to complete that mastered step independently, but then shift the reinforcement contingency to reinforce the successful independent completion of that mastered step, followed by the next step you are targeting for independent mastery. Reinforcing only the single mastered step, A, isn't moving forward. Reinforcing the entire task, B, is for total task chaining. Switching to backward chaining, D, isn't part of the forward chaining procedure. You add the next step they need to do independently to the requirement for reinforcement. Once they can do the first step alone, reinforce when they do the first step alone and the second step alone. Question 61. Which ethical principle requires RBTs to be transparent and honest in all professional interactions? A. Confidentiality. B. Dual relationships. C. Integrity. D. Responsibility. Answer: C. Integrity. Explanation: this question asks about the ethical principle encompassing honesty and truthfulness. Integrity means being honest, fair, and truthful in all your professional activities and interactions. This includes being honest with clients, families, supervisors, and colleagues, and accurately representing your work and data. Confidentiality, A, is about privacy. Dual relationships, B, are about professional boundaries. Responsibility, D, is about your duties. Integrity is about being honest and straightforward in everything you do professionally. Be honest and truthful in your work. Question 62. You are tracking instances of screaming. Your supervisor asks you to measure the rate of screaming per hour. You record 10 instances in a 30-minute session. What is the rate per hour? A. 10. B. 20. C. 0. 5. D. 30. Answer. B. 20. Explanation. This question requires you to calculate rate and extrapolate to a different unit of time. Rate is frequency per unit of time. You have 10 instances in 30 minutes. To find the rate per hour, you need to figure out how many instances would occur in 60 minutes if the rate were consistent. Since 60 minutes is twice as long as 30 minutes, you multiply the frequency by 2. 10 instances / 30 minutes equals x instances / 60 minutes. X equals 10 * 60. / 30 equals 600 / 30 equals 20 instances per hour. Alternatively, the rate per minute is 10 instances / 30 minutes equals 0. 33 instances per minute, 0. 33 instances / minute * 60 minutes / hour equals 20 instances per hour. If they did it 10 times in half an hour, they would do it 20 times in a full hour. Question 63. What is the primary purpose of using a graph in ABA? A. To make the data look nice. B. To summarize data visually and make clinical decisions based on trends and patterns. C. To hide variability in the data. D. To satisfy insurance requirements. Answer. B. To summarize data visually and make clinical decisions based on trends and patterns. Explanation. This question asks about the main clinical purpose of graphing data. Graphs provide a visual representation of behavior change over time, allowing the behavior analyst to easily see trends, levels, and variability in the data. This visual analysis is crucial for making database decisions about the effectiveness of interventions and whether adjustments are needed. While they can look nice, A. And meet requirements, D. The core purpose is clinical decision-making. B. Graphs are not used to hide data. C. Graphs help the team quickly see what the data is doing so they can decide what to do next. Question 64. Which of the following best describes a controlling prompt? A. A prompt that is physically forcing the client to respond. B. The lowest level of prompt that still results in a correct response. C. Any prompt that reliably evokes the correct response. D. A prompt that is part of most to least prompting procedure. Answer. C. Any prompt that reliably evokes the correct response. Explanation. This question asks about the concept of a controlling prompt. A controlling prompt is any prompt that, when presented, has a high likelihood of resulting in the client emitting the correct response. It's the level of help that effectively controls the response, making it occur reliably. It doesn't necessarily mean physical force. A. The lowest level of prompt that still works. B. Might be a part of identifying the most efficient controlling prompt, but isn't the definition. While controlling prompts are used in MTL, not all MTL prompts are necessarily controlling prompts for every client every time. D. A controlling prompt is the amount of help that makes sure they get it right almost every time. It's the prompt level that reliably gets the correct behavior. Question 65. When thinning a reinforcement schedule, the behavior is often put on extinction for brief periods when reinforcement is not delivered. If thinning is done too quickly, it can lead to A. Increased independence. B. Ratio strain. Decrease in behavior. C. Spontaneous recovery. D. Increased prompt dependency. Answer. B. Ratio strain. Decrease in behavior. Explanation. This question asks about a potential negative outcome of thinning reinforcement too rapidly, particularly with ratio schedules. Ratio strain occurs when the reinforcement schedule is thinned too quickly or becomes too lean. Too many responses required per reinforcement, resulting in a decrease in the behavior, pauses in responding, or even the client giving up entirely. Increased independence, A, is a goal of fading not thinning problems. Spontaneous recovery, C, is after extinction. Increased prompt dependency, D, relates to prompting issues. Thinning too fast can make the client feel like it's not worth the effort anymore, and they might stop trying. Question 66. Which statement is most accurate regarding the RBT's role in the service delivery system? A. RBTs conduct assessments, design intervention plans, and provide direct therapy. B. RBTs assist BCBAs/PCABs by implementing plans and collecting data under supervision. C. RBTs supervise other RBTs and oversee case management. D. RBTs provide clinical interpretation of data and make treatment decisions independently. Answer B. RBTs assist BCBAs/PCABs by implementing plans and collecting data under supervision. Explanation. This question clarifies the RBT's primary position in the ABA service delivery hierarchy. RBTs are paraprofessionals who work under the close supervision of a certified behavior analyst, BCBA or BCAB. Their main responsibilities are the direct implementation of skill acquisition and behavior reduction procedures and the collection of objective data, as directed by their supervisor, conducting assessments, designing plans, or supervising others. C, D are the roles of certified BCBAs/BCABs. RBTs carry out the plans and gather the information under their supervisor's guidance. RBTs are the team members who work directly with the client, following the plan from their supervisor. Question 67. You are tasked with reducing a client's hitting behavior using extinction. The function of hitting is attention. When the client hits, you are instructed to immediately turn away and remove all attention. What is a potential side effect you should be prepared for? A. The client might stop hitting immediately. B. The client might start hitting more often or harder initially. C. The client might start asking for attention politely. D. The behavior's function will change to escape. Answer B. The client might start hitting more often or harder initially. Explanation. This question asks about a predictable phenomenon when implementing extinction. An extinction burst is a temporary increase in the frequency, intensity, or variability of the behavior when reinforcement is first withheld. If hitting for attention is put on extinction, the client might initially hit more often, harder, or try other attention-getting behaviors before the behavior starts to decrease. Immediate cessation, A, is unlikely, especially if the behavior was reinforced consistently, while polite requests, C, might be taught as an alternative. DRE, the extinction procedure itself doesn't directly cause this. The function won't necessarily change just from extinction. D, expect an extinction burst. The client might try harder to get the attention that used to work. Question 68. What is a key difference between a skill acquisition plan and a behavior intervention plan? A. Skill acquisition plans target increasing behaviors. Behavior intervention plans target decreasing behaviors. B. Skill acquisition plans are written by RBTs. Behavior intervention plans are written by BCBAs. C. Skill acquisition plans use reinforcement. Behavior intervention plans use punishment. D. Skill acquisition plans are for children. Behavior intervention plans are for adults. Answer. A. Skill acquisition plans target increasing behaviors. Behavior intervention plans target decreasing behaviors. Explanation. This question asks for the primary difference in focus between these two types of plans. Skill acquisition plans outline the procedures for teaching new skills or increasing existing desired behaviors, example communication, social skills, daily living skills. Behavior intervention plans, BIPs, outline procedures for decreasing challenging behaviors, example aggression, self-injury, property destruction. Both are developed by supervisors, not just RBTs, and can use various principles like reinforcement, extinction, or punishment. C. They can be used for clients of any age. D. One is for teaching new things or increasing good things, the other is for reducing problem behaviors. Question 69. You are asked to collect data on a client's humming behavior, which happens frequently and sometimes continuously. Your supervisor suggests using time sampling. Which time sampling method would be most likely to overestimate the occurrence of humming? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Latency recording. Answer B. Partial interval recording. Explanation. This question asks about a specific type of discontinuous measurement and its tendency to overestimate. Partial interval recording overestimates the duration or frequency of a behavior because you mark yes for the interval if the behavior occurs at any point, even if it's very brief. Whole interval recording, A, underestimates. Momentary time sampling, C, can over or underestimate depending on the behavior and interval length. Latency, D, measures time to start, not frequency or duration. Partial interval is notorious for making a behavior look like it's happening more often than it is, because a brief instance counts for the whole interval. If it happens even for a second in the time box, you mark yes, which makes it look like it's happening more than it is. Question 70. What ethical guideline requires RBTs to avoid actions that could harm a client? A. Integrity. B. Professional boundaries. C. Non-maleficence. D. Fidelity. Answer C. Non-maleficence. Explanation. This question asks about the ethical principle of do no harm. Non-maleficence is the ethical obligation to avoid causing harm to clients. This principle guides decisions about interventions, procedures, and interactions, ensuring that client safety and well-being are prioritized. Integrity, A, is honesty. Professional boundaries, B, are about relationships. Fidelity, D, is about being trustworthy. The principle of non-maleficence is about actively working to prevent any harm to the client. Don't do anything that could hurt the client. Question 71. You are working with a client on sorting objects by color. You present a red block and a blue block and say, "Give me red." The client gives you the red block. What type of discrimination training is this? A. Simultaneous discrimination training. B. Successive discrimination training. C. Simple discrimination. D. Conditional discrimination. Answer A. Simultaneous discrimination training. Explanation. This question describes a specific procedure for teaching discrimination. In simultaneous discrimination training, both stimuli, the red block and the blue block, are presented to the client at the same time on each trial, and the client must select one based on the instruction, SD. Successive discrimination training, B, would involve presenting stimuli one at a time, and the client responds differently depending on which stimulus is presented. Simple discrimination, C, is a broad term for responding differently to an SDVs. S-delta, conditional discrimination, D, involves the correct response depending on a third stimulus. Since both options are there at once, it's simultaneous. Both choices are right there for them to pick from. Question 72. What is the difference between planned activities and spontaneous activities in a therapy session? A. Planned activities are always preferred by the client. B. Spontaneous activities are only for play. C. Planned activities are pre-arranged learning opportunities. Spontaneous activities arise naturally from the client's lead or environment. D. Planned activities require data collection. Spontaneous activities do not. Answer C. Planned activities are pre-arranged learning opportunities. Spontaneous activities arise naturally from the client's lead or environment. Explanation. This question distinguishes between structured and naturalistic approaches to therapy activities. Planned activities are those you schedule and prepare for in advance to target specific goals, often in a structured format like DTT. Spontaneous activities, sometimes part of natural environment teaching, NET, are those that emerge naturally during the session based on the client's interests, interactions, or events in the environment. Client preference. A. Varies. Spontaneous activities can be for learning, not just play. B. Data should be collected in both planned and spontaneous activities, if relevant to goals. D. Planned means you set it up. Spontaneous means it just happened. Question 73. What is the ethical guideline related to using assessment methods that are appropriate for the client's age, skill level, and the behavior being assessed? A. Scope of practice. B. Cultural responsiveness. C. Appropriate assessment methods. D. Beneficence. Answer. C. Appropriate assessment methods. Explanation. This question highlights the ethical requirement to select and use assessment tools and methods that are suitable for the individual client and the specific information you need to gather. Using appropriate assessment methods means choosing tools that are reliable, valid, and a good fit for the client's developmental level, communication abilities, and the nature of the behavior being assessed. Scope of practice. A. Is about who can do the assessment. Cultural responsiveness. B. Is important but focuses on cultural fit. Beneficence. D. Is doing good, which is a broader principle. Make sure the tools you use to assess the client are right for them and what you're looking at. Pick the right tools for the job. Question 74. When calculating the total duration of a behavior across a session, what do you sum up? A. The number of times the behavior occurred. B. The length of each instance of the behavior. C. The time between each instance of the behavior. D. The total time of the session. Answer. B. The length of each instance of the behavior. Explanation. This question asks about how total duration is calculated. To find the total duration of a behavior during an observation period, you measure how long each individual occurrence of the behavior lasts, and then add all those durations together. The number of times it occurred, A, is frequency. The time between instances, C, is IRT. The total session time, D, is the observation period length. Add up how long each time the behavior happened. Question 75. Which ethical guideline requires RBTs to avoid entering into personal relationships, like friendships or romantic relationships, with clients or their families? A. Confidentiality. B. Dual relationships/professional boundaries. C. Integrity. D. Responsibility. Answer. B. Dual relationships/professional boundaries. Explanation. This question revisits the concept of professional boundaries and dual relationships, a crucial ethical area for RBTs. You must maintain a professional relationship with clients and their families and avoid any personal, social, financial, or romantic relationships that could compromise your objectivity, create a conflict of interest, or exploit the client. This is covered under the ethical guidelines regarding dual relationships and professional boundaries. Confidentiality, A, is privacy. Integrity, C, is honesty. Responsibility, D, is duty. Keep your relationship with the client and their family professional only.